Welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society produced by HCPLive. Hosted by SOCS leaders, Skin of Color Savvy delves into the latest research, clinical insights, culturally intelligent and responsive practices, and other news important to treating patients of color. Today's episode will feature SOCS leader, Dr. Nkem Ugonabo, who will be talking about her leadership journey through SOCS and through dermatology. Dr. Ugonabo, please tell us a little bit about yourself.
Hi, thank you so much for having me. I am a board certified dermatologist based in New York City. I work primarily in private practice at a majority cosmetic and laser practice in Lower Manhattan. And then I am also in an academic role at Albert Einstein College of Medicine, where I serve as assistant professor and run a resident cosmetic clinic that I helped found it as well.
So I wanted to ask you actually first about what sort of drew you into the practice of dermatology.
Um, that's a great question. I would say I always was interested in derm because one, it's very hands-on. I love the fact that you get to, actually do things and do treatments and be able to, use my hands. And I love, especially on the cosmetic and laser side, that it's a combination of art and science, right? A lot of the treatments that we do are based, especially lasers, are based in physics. And so there's a lot of science to kind of understand the mechanism behind what you're doing, to understand what settings are appropriate, et cetera. But it's an art as well, right? You and the patient are essentially creating a map together of what you want it to look like. And I love the fact that you are able to cater to someone's needs that way. And then I would also say, derm is special to me because in contrast to other forms of medicine where we often have internal issues, right? Like if you had something wrong with your stomach, your heart, etc., it tends to be private unless you decide to share. But derm, because it's the skin, it affects not just your health physically, but also the social health, emotional health, because everything is so visible, right? So it affects how you interact with the world. And so, as a dermatologist, when someone has a skin issue that they are often self conscious about, there's some beauty in being able to treat and alleviate that and just kind of watching them grow and evolve, not just physically, but also like as a person as well. So, a little corny, I apologize, but it is my genuine favorite part of the field.
No, no, listen, it's not corny. And also, it may be the best answer I've received on this podcast
Oh,
in asking about it. So thank you for that.
of course.
And what a good point, too, about the visual nature of dermatology. I do think that probably is what makes it stand out among a lot of different subfields. And yeah, that makes sense that you would want to address that kind of thing. And then on that topic, what kinds of conditions and concerns do patients typically come to see you about?
Yeah, so quite a few. I would say, pigmentary issues tend to be quite popular, right? So people who have everything from sunspots, melasma, hyperpigmentation, etc. People who are also bothered by, skin issues related to aging, so like wrinkles, whether they're dynamic or like sagging skin, etc., ends up being popular. And then, everything from vascular issues like rosacea or port wine stains. Lip lesions are also increasingly common as well. So, being mostly a cosmetic slash laser person ends up being a very broad spectrum of conditions that we treat across all ages and all genders. So I really like that.
Excellent. Yeah, thanks for sharing that. And then what would you say are some of your clinical and research passions within dermatology that you care the most about?
Yeah, I have published, I would say, the most extensively within acne, whether it's acne, from a medication perspective, like isotretinoin, but also like acne treatments or acne lasers and acne scarring. Also, a lot of pigmentary things that are interested, so like melasma treatments, doing some things now on like hyperpigmentation. Laser hair reduction has been another area of interest of mine. I'd say those are the main categories that I've been lucky enough to publish in.
Excellent. Yeah, well, thanks for sharing. So let's talk then about a little bit about your journey through the Skin of Color Society. So when did you first become involved and what sort of drew you into the organization?
I first became involved as a resident when I was still in training to become a dermatologist. I was drawn by the organization's the fact that they embraced, dermatologists in trainings and actually had programming created specifically to help cultivate us as trainees. So specifically, I was drawn by like the mentorship program, and then later the research program. So I was kind of in awe that there was an organization that existed that have so many heavy hitters that we look up to in derm as like leaders and in positions of co-chairs and board of directors, etc., but that they also spent a big part of their time trying to make sure that they were cultivating the next generation of dermatologists.
Absolutely. I know that the mentorship part I think is key. I think everyone kind of enjoys that aspect of it, especially being a mentor or even being a mentee, honestly. It's a nice kind of collaborative element to it that I think a lot of people take from it. So that's nice to
Yeah.
hear.
Yeah.
Okay, so I wanted to also ask you about your award that you were given, the SOCS Research Award in 2022. So congratulations. I know it's been a couple of years since then,
Yeah.
but congratulations. And please feel free to tell us a little bit about your work and the important takeaways from your research related to that.
Yeah, so that award was done during my fellowship year. I did a fellowship specifically in the cosmetics and lasers prior to making that my subspecialty. And at the time, they were doing quite a few treatments for melasma, laser treatments for melasma, and then there were quite a few topical treatments for melasma as well. Melasma, of course, for the listeners, being the condition where you have hyperpigmented patches, often symmetrically on the cheeks, sometimes forehead, sometimes upper lip, etc., heavily associated with social stigma and issues like that. And so we try our best to treat it in multiple ways. So there was laser treatments and there were topical treatments, but there weren't a ton of research or available data on the combination of the two outside of one or two specific topicals. And so there was a new topical that was being used called cysteamine. And so I was very curious to know, we know this topical works on its own. What if we combine it with a laser? Would it work even better? Because we know the laser works on its own as well, right? So it was kind of a unique idea that at that time had not been done. And initially, I wasn't sure I was going to be able to like find someone to actually support the idea. But then I was really lucky to find out about the research award that SOCS offered, and to actually have been awarded the research award. So that allowed us to kind of trial it out and study it in our practice.
That's excellent. That sounds very rewarding too, to finally, well, not finally, I'm sure you got a lot of attention, but to receive attention for something like that with the research award it's a rewarding thing.
Yeah, and we were actually even lucky enough to be able to present our findings. The next fellow was able to present the findings at one of the largest laser meetings in the country called ASLMS. So
Wow.
yeah, it was definitely like it was something that we would not have been able to do without support from SOCS.
That's excellent to hear. Well, since then, I know you've been actively involved in committee work. So please tell us about that and the rewards you've derived from your services as a committee co-chair.
Yeah, so I initially joined what was previously called the Media and Communications Committee, initially just as a member, and I think it was just a really good fit to my personal interests and skill set. So I was a very active member, so much so that eventually, a year or two later, I was asked to be a co-chair of the committee, and from there, we were able to really take advantage of the growing, I would say, social media population in general. Things like Instagram, Facebook, are becoming so popular, and it's a really great outlet, I think, for people to hear about SOCS and to hear what SOCS is doing, to be exposed, and then to also have education about a lot of issues that are passionate to members of SOCS. And so we really, really grew the media platform significantly during my time as co-chair, and it continues to grow. Everyone, as a side note, please follow the Skin of Color Society on all channels. But yes, from there, I still am co-chair today of the committee. And then most recently, I was asked to join the board of directors. So I'm really excited about that too.
That's exciting. Well, okay, then I'll ask you because I know you joined the board of directors at SOCS. So please share with us what it means to you now to sort of be involved at the senior leadership level.
Honestly, it's a very full circle feeling, right? As someone who's been involved in the organization since I was a trainee, and to now be on the other side of it where I can ideally help shape the organization so that future trainees can, have a similar experience that I did. It's very special. I feel, I would say, primarily honored to have been asked and excited to serve the board. I think, we are in very we're in a very interesting time right now, and people are really interested in a lot of the things that SOCS is doing. And so I think it's super exciting to be at the leadership level where we can kind of help shape the future of that.
Absolutely, yeah. Do you feel like the interest level, just related to what you were saying there, do you feel like the interest level has increased in recent years, or what do you feel like is the kind of the feeling out there among clinicians and future clinicians?
Yeah, I do, honestly, because I think that, I think there's a lot more awareness about whether it's, how skin of color, how people of color react differently to like certain products or certain laser treatments or certain cosmetic treatments or even medical treatments. I think we are learning more as clinicians in medicine in general, and that allows us to kind of tailor more specific needs for different populations. I think you see it even, go across the aisle to like the beauty aisle with something like simple as sunscreen, right? Now there's so many companies coming out with a broad range of like tinted sunscreens, which is amazing to have that sort of like representation, which helps us as dermatologists actually convince people to wear sunscreen because now they can find one that will match their skin tone a little bit better and not leave them with like that dreaded white cast. So I just love the fact that, people are becoming more aware, more educated, and there's a lot of excitement in the field as we all, all across dermatology learn how to better serve our patients because ultimately that's what it's about at the end of the day.
Yeah, no, absolutely. Okay, well then, could you share with us any words of advice for early career physicians who are looking to become more involved in their professional organizations?
Yeah, I would say you don't have to know exactly how it's going to map out in the beginning. I would say for stocks, for example, when I first joined the committee, I had no intent of, going as far as I did with it. I just wanted to help. And I think when you have genuine intentions and then you also have like the energy and time to put behind it, then things can sort of blossom, right? But don't feel overwhelmed by trying to precisely plan out how everything is going to go. I think sometimes, and I'll speak for myself, as physicians, when we are going through school and training, everything is quite ordered, right? It's undergrad, it's med school, it's residency, it's fellowship, etc. And then when you graduate, you can kind of feel like almost like you're floundering a little bit, like you can't really figure out what's next. And I think that can be a little overwhelming for people. But I would say there's nothing wrong with sort of figuring it out as you go along. Definitely utilize mentorship as much as you can. And mentors can be people, obviously, who are much more senior and have leadership positions, but also even your peers. Some of the best advice I've gotten have been people who are, 2 or 3 years older than me, right? But they were very recently in my shoes and able to sort of guide me that way too. So I'd say don't necessarily feel like you have to have everything planned out, but if you do feel a little bit lost or you just want a little bit of guidance, don't hesitate to reach out to people who are your peers or even more senior than you.
That's such a great piece of advice, I think. Especially, I mean, I don't know, I'd like to hear your thoughts on this as well, because I know that some people feel, weird about reaching out to mentors or people that can provide them mentorship. But I think a lot of times people who, when they get seen as mentors, feel kind of good about what they've achieved in their life. And they kind of want to help because they feel like it's a nice moment for them to be able to kind of share some wisdom. Do you feel that that's the case?
I do, yeah. And I think, if you ever reach out to someone and you don't get an enthusiastic response, now being on the other side of it, I can tell you it's probably more a reflection of like capacity
Right.
and time. But it's tempting to take it personally, but I promise you do not. Everyone is just like super busy. Sometimes we miss emails here or there. But I think, everyone is flattered to be asked. And if someone doesn't necessarily have the capacity to be as helpful as like a formal mentor, then they can maybe, give you more like specific pointed advice. And then maybe like you can revisit in the future when they have more capacity. So don't be afraid to ask. I don't think anyone will be offended by the question. They may or may not be able to be super helpful, but they can at least try. And if they have the capacity, they can do what they can with it.
I see. Okay, that's great. Thank you. Well, I mean, I'd like to ask you a little bit more. Actually, you've actually dispensed a lot of advice today, which we really appreciate, obviously, on this podcast. But I'd love to close with your favorite pearl of wisdom to sort of inspire your medical colleagues. So, if you could share with us just an insight that's been meaningful to you in your journey as a physician, and as a developing leader in the field, please feel free.
Oh, that's a good question. I would say one pearl, mostly from a clinician perspective, is if you look, I'm a cosmetic person, so this will be a little bit more towards procedural, but I think it's important to do procedures and treatments that you believe in and that you feel strongly about. And I say that because in the beginning, it's tempting to be like jack of all trades and to offer everything and do everything. But if there's a treatment that you are just not as enthusiastic about, not that you're necessarily against it, but just you personally don't necessarily love doing it, it's important to just be honest with yourself and be honest with the patients, because it's going to show over time that you're not as excited. And then also you want to focus on the things that you genuinely have a passion for. And then that's how you build your expertise. So don't feel like you have to do everything. It's okay to try everything in the beginning, because that's how you know if you'll like it or not. But once you figure out what you actually enjoy doing, because this is a marathon, not a race, so we have a long ways to go in our career, it's okay not to do certain things. And if a patient wants something done, I am always happy these days to just refer them to a colleague that does do it, that I would trust, rather than to do something that's not necessarily going to have enthusiasm behind it.
Excellent. Okay, well, that's a great piece of advice to end on, I think. So thanks so much for that. Thanks in general, Dr. Ugonabo, for your expertise and sharing it with us today. We really do appreciate it.
Oh, you're very welcome. Thank you again for having me. Pleasure's
Uh,
mine.
Yeah, absolutely. Well, and to our listeners, we hope you found today's episode enlightening. And if you're interested in learning more about the work of the Skin of Color Society, please visit skinofcolorsociety.org. Don't forget to subscribe to HCPLive's newsletters and follow us on social media to stay up to date on the latest in dermatology and more. And we will be back soon with another episode. So be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. And until next time, take care and thank you for listening.